Hello and welcome to the VJNeurology Podcast. We are an open access video journal providing medical education and news across all major neurology disciplines. Today's podcast episode focuses on the impact of climate change and temperature fluctuations on the management of epilepsy. You will hear from Anita Arsovska and Medine Gulcebi Idriz Oglu, who will delve into the effects of rising temperatures on seizure frequency, the supply chains of anti-seizure medication, the stability of anti-seizure medication, and adverse reactions to medication. So without further ado, Dr. Arsovska will kick us off with her insights.
These adverse weather events and temperature fluctuations are becoming more frequent and severe, and these rising temperatures cause climate changes, and climate changes influence the occurrence of stroke and epileptic seizures. So they have direct and indirect consequences for people living with these conditions. When it comes to epilepsy, these temperature extremes, humidity, heat waves, atmospheric pressure can influence the seizure frequency. It was shown that during summer months, there is increase in seizure frequency compared to winter months. So basically, these adverse weather events or the effect of global warming can play a significant role in triggering the seizure precipitants, or they can alter the risk of epilepsy. Also, these extreme temperatures may affect the quality of life in epilepsy. This is strongly associated with seizure control, and seizure control is actually related to the adherence and supply of anti-seizure medication. But sometimes these adverse weather events can disrupt the supply chains, and this can potentially lead to compromise seizure control. People with epilepsy suffer from comorbid conditions such as depression, anxiety, migraine, dementia, heart disease, and this is more frequent compared to the general population. And also, people with drug-resistant epilepsy are often on polytherapy. So that is why during these extreme temperatures or adverse weather events, the supply chains can be disrupted, and therefore this can potentially lead to compromised seizure control. Also, extreme temperatures affect the pharmacological characteristics of anti-seizure medication, especially extreme high temperatures and extreme humidity. Anti-seizure medication have very narrow therapeutic window, and even a slight variation in their pharmacokinetics can lead to therapeutic failure or unwanted events. Again, the physicochemical stability of anti-seizure medication can be affected by high temperature, and that is why specific storage temperatures are required for anti-seizure medication. They usually range between 15 to 30 degrees, except for the liquid formulations of gabapentin or lorazepam that require refrigeration. Also, some drugs, anti-seizure medication, can be light sensitive, and therefore it is recommended that they are stored in airtight and light-resistant containers in order to sustain their stability. The other thing that we need to be aware is that sometimes these medications are kept in so-called dose administration aids in order to improve the adherence in chronic drug treatment. However, in countries with tropical climate or in desert regions, these aids can actually compromise the stability of the drugs because they cause reduced bioavailability of the drugs. And then patients also might experience increased frequency of the seizures. It is also important to have in mind that some hospitals do not have their own laboratories to investigate the dosage of the anti-seizure medication in the blood. And therefore, sometimes these blood samples are kept in conditions that may influence their level in the blood. So we need to know that these serum samples should be stored in a temperature of 4 to 8 degrees for a maximum of 7 days in order to maintain the quality of the samples, in order to achieve accurate results for the individuals, because the dosage of the drugs is sometimes related to the blood levels of these drugs. And what would be the suggested mechanism of these adverse responses of the drugs is that some drugs actually cause extreme perspiration, and some drugs actually reduce the perspiration during extremely hot weather. And also, the suggested mechanism is change in the activity of these hepatic cytochrome P450 enzymes. So basically, most of these anti-seizure medication are metabolized in the liver, and therefore, during extreme temperatures, sometimes changes in the activity of the liver enzymes can happen, and therefore this actually affects the metabolism of the drugs. But not only hot temperatures can cause changes in the drug response of anti-seizure medication. There are some studies that actually showed that during spring also, sometimes we can see this study was performed in Russia. So we can see a lower minimum and maximum concentration of the drugs such as carbamazepine or valproic acid. And this also led to increased number of seizures and also increased severity of the seizures. And another thing that we need to bear in mind is that sometimes in extreme temperatures can actually increase the incidence of adverse drug reactions. There are examples in the literature that there was a marked increase in the phenytoin rash incidence during the summer compared to other seasons. This study was performed in the United States of America, and it was observed that when the drug was introduced during the summer months of June, July, and August, there were highest rate for cutaneous reaction within the 3 weeks of initiation of the therapy with phenytoin. However, when treatment was initiated in the winter months of December, January, and February, then no reactions were seen. And the potential mechanism was attributed to the protective effects of a more activated immune system during the winter. Another example of the climatic factors on the anti-seizure medication induced cutaneous adverse drug reaction was photosensitivity that was associated with the usage of lamotrigine. And this was a case report that was described in a patient after exposure to sunlight or solarium usage. The patient developed toxic epidermal necrolysis, and this condition resolved after the discontinuation of lamotrigine. So basically, there are some research gaps that need to be addressed, such as the physicochemical stability of the drugs. We need to look more into the altered liver enzyme activity and other key factors in the drug metabolism. Also to look for more vulnerable groups such as elderly and children, and to see what is the impact of comorbidities and co-medication in patients with epilepsy.
Now we turn to Dr. Idriz Oglu, who will delve deeper into the impact of climate change on anti-seizure medication and how this affects individuals in low and middle income countries.
This question is important because the medications that are used for the people with epilepsy are called first the anti-seizure medications. And these medications, if we approach this question pharmacologically, these anti-seizure medications have narrow therapeutic index, and they are the drugs that we always need to consider their adverse reactions or their therapeutic failure in terms of people with epilepsy. So in terms of climate change, firstly, we need to remember that all these medications, and including anti-seizure medications, could be affected from exposure to high temperature and humidity. Their pharmacological stability may change, their pharmacokinetic characteristics may change, even their pharmacodynamic characteristics may change after exposure to high temperature and humidity. But it is difficult to give clear answer to each of these anti-seizure medications because there are more than 30 available anti-seizure medications today, and we do not have evidence-based literature for most of them. But we know for example, carbamazepine, for example, valproate, for example, levetiracetam, that these anti-seizure medications, their pharmacological stability may change with exposure to high temperature and humidity. If we think about the pharmacokinetics, again, the adverse weather events such as heat waves, cold spells could play important role in changing in alternation of pharmacokinetics of these medications. There is scarce information regarding this question, but we can give some examples to this. For example, for phenytoin, or for example, for carbamazepine and valproate. Again, there are some studies that have shown the changes in their blood levels during summertime, for example, during the hot days, extremely hot days. The serum concentration, blood concentration of these drugs may change, may decrease. And this is important for people with epilepsy because they use these anti-seizure medications to control their seizures, which is very important for their quality of life. And therapeutic inefficiency may occur if the blood levels of these medications decrease. And also, adverse drug reactions are very important. There are some case reports shown for lamotrigine photosensitivity reactions, also for phenytoin rash. And during hot days under the sunlight, exposure to sunlight, the adverse reactions, the photosensitivity or rash reactions may occur. This reaction, the risk for this reaction increases during these hot days and under exposure to long periods of sunlight, let's say. So anti-seizure medications are important medications because we need to follow blood levels of anti-seizure medications during not only for adverse weather events, but for also all the seasons, let's say, because they have narrow therapeutic window. This means that the dose changes or the environmental changes may affect their blood levels, and their blood levels, if change, then the people with epilepsy may experience disruption in seizure control, or may experience some adverse drug reactions. Firstly, I would like to underline that there are some countries which are already more vulnerable to climate change effects than the other countries. And they have some vulnerability scores. Each country has its own vulnerability score. And this score is based on more than 70 different aspects. And when we look at these vulnerability scores of the countries, we see that particularly low to middle income countries have higher vulnerability scores to climate change effects than the high income countries. And for the people with epilepsy, when we look at the burden of epilepsy, we know that the burden of epilepsy is at least twice in the low to middle income countries compared to high income countries. So this means that firstly, the risk of climate change adverse events for people with epilepsy living in low to middle income countries are higher than the people with epilepsy living in high income countries. And also, we know that the burden of epilepsy is very important in the refugee camps. So these people living in these camps are already considered vulnerable to climate change effects than the other people. Because we know that, firstly, displacement of people from their countries or from their own region, let's say, is a major risk factor to experience climate change effects. For example, not for the refugee camps, but I can give an example for the wildfires that we just lived in Europe and mainly in Turkey, let's say, just for about a very short period in July and August, let's say, around, I think, 98,000 people left their homes in the Europe. And this means that their medication, their management of their epilepsy will be disrupted just because of this, because we know that quality of life of the people with epilepsy depends mainly on their seizure control. And in order to provide a good seizure control, they need to use anti-seizure medications. And this means that they need to they should be able to reach their medications very easily. And if we think about the people displaced their regions, like in the people in the refugee camps, firstly, it will be very difficult, complicated for them to reach their medications. And adherence to medications is very important. This is another thing. Even if you can reach your medication, you need to use it regularly in order to provide a good seizure control. And let's think about all these countries, all these refugee camps, or the people left their homes, their areas. Adherence to drug medications, of course, will be disrupted during adverse weather events such as heat waves, cold spells, flus, wildfires, or hurricanes.
Finally, Dr. Idriz Oglu will share potential solutions to address the impact of climate change on the management of epilepsy.
I think vulnerability is the big issue that we need to solve for climate change effects on people with epilepsy. So we know that there are already vulnerable countries to climate change effects. And we know that there are also vulnerable people to climate change effects, not only the people with epilepsy, but also elderly people, for example, children, for example, pregnant people, for example, or people with some chronic diseases such as respiratory, cardiovascular, or neurological disorders are considered more vulnerable to climate change effects than the others. But if we think about epilepsy, the disease is heterogeneous. So disease-based factors also contribute to this vulnerability. So I think the first practical step for the physicians to take care should be to understand, to explore the vulnerability of people to climate change effects. In low-income countries that have limited health care, for example, or limited medical staff, or with a huge treatment gap, climate change effects will be much more important than the other countries. So the physicians, I think, as a first step, should explore the vulnerability of their patients to climate change effects because, as I said, disease-based factors are also very important. There are also some other vulnerability factors. And then if their patients they believe that more vulnerable to climate change effects than the other people with epilepsy, then I think the next step is giving some practical tips to their patients in order to protect them, in order to avoid some adverse weather events. And of course, the big solution depends on the governmental solutions. The stakeholders, all these people should take some responsibilities in order to solve all these climate change related adverse consequences for the people with epilepsy, let's say.
Thank you for listening to this episode of the VJNeurology Podcast. We hope you enjoyed. Head over to VJNeurology.com to see more content on epilepsy and other neurological disorders. Be sure to follow us on X at VJNeurology and subscribe to our podcasts on Spotify, Apple or Podbean so you never miss an episode.